If stories like this move you, hit like and subscribe before you read another word. New stories every week about ordinary people doing extraordinary things. This is a story about what happens when a man who has spent his life healing people decides in one moment that some people are not worth his time. When a white coat and a medical degree convince someone that they already know the value of the person standing in front of them before asking a single question. When prejudice wears the face of professionalism and calls itself clinical judgment. And when the universe arranges, with a precision that no one could have planned, for that same man to find himself in a hospital corridor, grateful beyond any words he knows, to the woman he turned away. She had been waiting for 40 minutes when he walked past her. The waiting room of Hargrove Medical Associates was full that Thursday afternoon. 8 people in chairs, a receptionist behind a glass partition, a television mounted in the corner with the volume set too low to hear. Amara Osei had arrived at 2:15 for a 2:30 appointment. She had her insurance card. She had her referral. She had her medical history printed on 3 pages in a folder on her lap because she had learned over years of navigating the American healthcare system that arriving prepared was not optional. It was the only thing that gave her any leverage in rooms that were not designed with her in mind. She had been experiencing chest pain for 6 days. Intermittent, sharp, coming in episodes lasting between 30 seconds and 2 minutes, then fading completely. She had documented every episode in the Notes app on her phone. Date, time, duration, severity on a scale of 1 to 10, whatever activity she had been doing when it began. 7 entries. The most recent that morning at 6:45 while she was getting dressed for work. She was 41 years old. She was a cardiothoracic surgeon with 14 years of experience operating on human hearts. She was on a 3-month sabbatical, following a research fellowship at Johns Hopkins, which was why she was in this city, in this clinic, seeing a general practitioner for a symptom she was professionally qualified to evaluate but ethically could not evaluate in herself. She had made her appointment through the standard referral process. She had insurance, she had documentation, she had done everything correctly. None of this was visible to Dr. Richard Calloway when he walked through the waiting room at 2:48. On his way from one examination room to another, and let his eyes move across the people seated there. Dr. Richard Calloway was 57 years old. He had been practicing internal medicine for 28 years. He had built Hargrove Medical Associates into one of the most profitable private practices in the city, serving a clientele that was overwhelmingly white and predominantly wealthy. He was technically skilled, professionally credentialed, and possessed of a specific and long-cultivated blindness about the ways in which his assumptions about patients shaped his care before he spoke a single word to any of them. He did not think of himself as a biased man. He had never examined this belief with any rigor. He looked at Amara Osei, sitting in the 3rd chair from the left, and he made a decision. He walked to the receptionist's window and spoke quietly. The receptionist looked up once at Amara and looked back at Dr. Calloway and nodded. At 3:05, the receptionist called Amara's name and told her Dr. Calloway would not be able to see her today. There was an issue with her referral paperwork. The practice would need to verify her insurance before scheduling. She was welcome to call to reschedule once the issue had been resolved. Amara looked at the receptionist. She had her insurance, card on the counter in front of her. Her referral was in her hand. She had documentation of 7 episodes of chest pain over 6 days. "I have all my paperwork here," she said. "There seems to be an issue with the referral code," the receptionist said. She did not make eye contact. "What is the issue specifically?" Amara asked. The receptionist said she would need to check with the billing department and that it might take a few days to sort out. Amara looked past the receptionist's window to where Dr. Calloway was visible through the partially open door of the hallway beyond, standing with a chart, not moving toward any room, watching the front desk with the particular stillness of a man waiting to confirm that an instruction has been carried out. She understood. She had understood before the receptionist finished her first sentence. She had understood the moment the receptionist's eyes went to her and then back to Dr. Calloway. She had been understanding this specific situation in its many different forms and contexts and professional settings her entire adult life. The recognition came without surprise now, only with the familiar and specific weight that settles somewhere in the chest and stays there for the rest of the day, and sometimes longer. She took her insurance card off the counter and put it in her wallet. She picked up her folder. She said thank you, and she walked out of Hargrove Medical Associates and stood on the sidewalk in the afternoon light for a moment. Then she called a colleague on staff at Regional Medical Center 2 miles away and made an appointment for the following morning. The workup at Regional took 2 days. The results showed a significant anomaly in her left anterior descending artery, a partial blockage that explained the episodic chest pain completely and that, if left unaddressed, would progress. Not an emergency at this moment, but requiring careful monitoring, medication, and a cardiothoracic consultation. The attending physician, who knew who she was, had the uncomfortable experience of explaining a cardiac finding to a cardiac surgeon while maintaining professional composure throughout. Amara listened to everything, asked 2 questions, made notes, left with a treatment plan and a follow-up appointment scheduled. She did not think about Dr. Richard Calloway again for 4 months. What she did during those months was what she had always done: her work. The sabbatical was not a rest. It was a different kind of work. Research, writing, 3 speaking invitations at medical conferences, where she presented findings from her fellowship on minimally invasive repair techniques for congenital cardiac defects in pediatric patients. She had developed a modification of an existing surgical approach that produced measurably better outcomes in a subset of cases historically among the most difficult to treat successfully. She had published the results. Other surgeons had replicated them. It was the kind of work that accumulates meaning over years without announcing itself loudly in any single moment. She returned from sabbatical in the fall and went back to operating. 6 weeks back at work, the case came to her. Through the referral network that connects families whose children have exhausted available options to surgeons whose names appear at the end of those consultations as people whose skills might address what others could not. The patient was 7 years old. Her name was Charlotte. She had a congenital cardiac defect of specific complexity evaluated by 4 surgical teams over 18 months. All 4 had recommended waiting or offered approaches carrying significant risk. The most recent team had suggested there was a surgeon whose published work indicated a possible alternative approach. Amara reviewed Charlotte's file for 2 hours before agreeing to see her. Imaging, surgical history, previous evaluations, specific anatomy of the defect. She made notes, drew diagrams, considered whether her modification was applicable and what the variables were. She agreed to see the patient. The family came on a Tuesday morning. Charlotte was a small girl with dark hair and the particular solemnity of a child who has spent too much of her short life in medical settings and has absorbed something of their gravity. Her mother held her hand. Her father sat with the rigid posture of a man holding himself together through will and not much else. Amara spent 40 minutes with Charlotte, explained what she was looking at in terms the child could follow, answered every question the parents asked clearly and completely. At the end of the consultation, she told them she believed the modification approach was applicable to Charlotte's anatomy and that she was willing to operate. The father's face changed when she said it. He had been holding himself very carefully, and something in him released, not into crying, but into a different kind of stillness. A stillness with something in it other than tension. She looked at him, and something in his face registered as familiar in a way she could not immediately place. She looked at his name on the intake form, Richard Calloway. She sat with that for a moment. Then she looked up and looked at him directly. He was looking at her. and she could see the precise moment when he placed her. Not from the intake form, but from her face, from the specific quality of her stillness, from the particular way she occupied a room that he had apparently not forgotten even from a brief waiting room observation 6 months earlier. She watched him understand. She watched the understanding move through his face like weather. Disbelief first, then recognition, then something adjacent to guilt. The shape of a man confronting the distance between who he believed himself to be and what he had actually done. Neither of them said anything about it. She said her coordinator would reach out about scheduling. She said Charlotte was a strong candidate and that she felt good about what the procedure could achieve. She shook the mother's hand. She shook Charlotte's hand carefully, the way you shake the hand of someone small and important. She looked at Richard Calloway, extended her hand. He took it. She shook it once and let it go. She walked out and went to her next patient. The surgery was scheduled 3 weeks later. Amara spent those weeks the way she always spent weeks before a complex pediatric case, in preparation that did not look like preparation. It looked like walking, like sleeping regular hours, like cooking dinner and calling her mother on Sundays. The preparation of a person who understands that the body and mind perform at their best when they are not depleted, and who treats the weeks before a difficult operation as training for the operation itself. In the evenings, she also sat with Charlotte's imaging, not anxiously, but the way a musician sits with a score before a performance, not to learn it, to be with it, to let the specific details settle into her hands before her hands were asked, to act. The morning of the surgery, she arrived at 5:45. She scrubbed. She went through her preoperative routine with the thoroughness her residents understood was not performance of process, but genuine necessity. She spoke with the anesthesiologist. She looked at the imaging one final time. Then she went in. The surgery lasted 4 hours and 22 minutes. In the second hour, the anatomy presented a variation from what the imaging had shown. Small but significant, requiring a real-time decision not in any written protocol. Her 14 years of operating on hearts told her what the decision was. She made it. She moved forward. Charlotte went to the ICU. Her numbers were good. Amara sat in the surgeon's lounge for 12 minutes after the operation. She drank coffee. She let her hands, still slightly trembling the way they always did after a long case, gradually still themselves. Then she went to find the family. They were on the 4th floor. Charlotte's mother stood immediately when Amara came through the door. Her father stood a half-second later. Amara told them what they needed to hear. The surgery had gone well. Charlotte was in the ICU and being closely monitored. There had been 1 point of anatomical variation she had. Addressed in the moment, early indicators were positive. She felt confident about the outcome. Charlotte's mother said, "Thank you," in the way people say it when they know the words are not sufficient, and say them anyway because they are all that is available. Richard Calloway looked at Amara. He had the look of a man who has just been handed back something he did not know until this moment that he could lose. His daughter's future, the simple and irreplaceable fact of his child being alive in a room down the hall, her heart doing what hearts are supposed to do. He said, "I need to say something to you." She waited. 6 months ago, he said, "In my clinic. I know you were there. I know what happened." He stopped. Started again. "I know what I did. And I know I am only standing here talking to you right now because you are a better person than I have been. Because you did not let what I did change who you are or how you do your work." He stopped again. Looked at the floor and then back at her. "I am sorry," he said. "I know that is not enough, but I am sorry." Amara looked at him for a long moment. She thought about the waiting room, the 40 minutes, the referral in her hand, the receptionist's eyes, going past her to where he stood watching from the hallway, the weight that settled in her chest that afternoon and stayed into the evening. She thought about the 6 days of chest pain she had been experiencing before she came to his clinic. about what might have happened if the blockage in her LAD had progressed before she found another physician willing to see her. She thought about Charlotte's imaging on her desk in the evenings, her hands learning the specific shape of a 7-year-old heart before she was asked to repair it. She said, "Your daughter is going to be all right. That is what matters right now. Go be with your wife." She turned and walked back down the hallway. She had a resident to debrief, notes to write, a follow-up schedule to establish. She went back to work. Charlotte spent 9 days in the hospital. By the 5th day, she was asking about going home. By the 7th, she was telling nurses about a book she was reading. By the 9th, she left with her parents and a detailed recovery plan. Amara saw Charlotte 3 more times in the 6 months following the surgery. At each appointment, Charlotte was a little taller, a little louder, more completely herself. By the 3rd visit, she had the particular confidence of a child who has been through something very hard and come out the other side, understanding she is more capable than she previously knew. Amara watched her walk out of the consultation room, with her mother and her school backpack, and thought about her grandmother's kitchen in Accra. The smell of groundnut soup, sitting at the table at 8 years old, being asked what she wanted to be when she grew up, and saying without any hesitation, a doctor. Her grandmother did not ask why or whether she was sure. She put another bowl of soup in front of her and said, "Then you had better eat and keep your strength up." She had been keeping her strength up for 33 years. She had every intention of continuing. Richard Calloway sent a handwritten letter 6 weeks after Charlotte's discharge. She read it once, put it in a drawer at home. She did not write back. She did not know yet whether she would. She understood his apology was real, and that real apologies deserved to be treated as real. She also understood she was not obligated to make his reconciliation comfortable or fast, and that the pace of forgiveness, when and if it came, was hers alone to determine. She went to work the next morning, scrubbed, operated, did the thing she had known since she was 8 years old, sitting at her grandmother's table that she was built to do. The truth has a way of surfacing. Even when a physician turns a woman away from his waiting room without examining her, without asking a single question, without doing the thing his entire profession requires him to do. Even when arrogance wears the face of clinical judgment, the truth surfaces. In the operating room, in 4 hours and 22 minutes, in a 7-year-old girl going home with her parents, her repaired heart doing exactly what it was supposed to do. It surfaces. It always does. It always will. Hit. Like. It helps more than you know. Subscribe and hit the bell. We tell stories like this every single week. Share this today with someone who needs to be reminded that excellence does not require the validation of the people who refuse to see it. And leave a comment. Have you ever been turned away from something you deserved and gone on to prove the person who turned you away was completely wrong? Tell me. You deserve to be heard. See you in the next one.